Hi there, it's Edwina here, and I wanted to just make this quick video for you to come back to as we've discussed your persistent pelvic pain, or what we sometimes call chronic pelvic pain. The next steps is that we're going to involve a multidisciplinary team as a holistic approach to your pelvic pain that's got the best evidence for you to have long-term improvement and work on your goals of care. Everyone's got different goals, so some people might be wanting to work on decreasing daily flares of pain or having decreasing persistent pain in the background. Other people might want to work on pain with intercourse. Other people want to work on bowel pain that's waking them at night, or pain with their menstrual cycle. It's important to know that everyone's goals of care are different, but we will want to talk about them with physio and myself, and also the GP as the first instance, and then we may move in with pain osteos, pain psychologists, and lots of other fantastic allied health practitioners that are all very experienced in managing goals of persistent pelvic pain. One of the first things that I'll do though will be to look at suppressing the menstrual cycle, because the menstrual cycle is often one of the main players in flaring your pain. One of the things we would have talked about today is the role of different types of what we call hormonal contraceptions, but they are now being used not for contraception, but they may be beneficial for that, but just to try and settle down pain with menstruation and sometimes pain with ovulation. We would have talked about medications such as Endo to help with sleep, and they are a medication that is like putting on noise cancelling headphones or turning up the volume on the TV when everyone's running around, so that the right signals are getting through to the brain and so that you're not getting all the background noise. And that allows your brain to not have all this impulse in, and it is very, very effective with persistent pelvic pain, and very effective often if you're having waking with sleep at night time. Medications such as Endo have got really good data and often are used for background pain such as headaches, bloating, migraine. There's an excellent link from the Pelvic Pain Foundation on Endo that I would have given you, but you can also have a look at it in the notes below. I also would have given the details of different women's physiotherapists that work locally, and they are fantastic practitioners. They work in terms of helping to downtrain the pelvic floor, learning how to open your bowel properly, do a wee properly, and work on how to move the pelvic floor properly with intercourse, doing exercise, all sorts of things. We use our pelvic floor all the time, and we know that in many women there's a background pelvic floor component, or what we call myofascial tenderness or spasm, and until we treat that, we feel that women's pain doesn't completely improve. It's important during this journey to think about what you're eating in terms of how that influences your bowel, to think about how your sleep's been impacted and your mood overall. This journey takes quite a few different months. Remember that everyone's journey is really different, and everyone often has different members in the team. And if you've got any allied health practitioners that you want to involve, let us know. We will always involve them in our communication, and we also will be able to kind of work on the different goals of care with you. Look forward to seeing you at your follow-up, and if you've got any further questions, please reach out to our team.